Order. It is great to see so many of you here today. I know the rest of the campus is on spring break, but it's great to see pharmacy students here still learning. And I know you didn't have a choice to at least be in school today, but you did have a choice to come to the Bizzell Lecture Series. And so we're very excited to have you here. And I'll turn it over here to a second to introduce our guest speaker. But before I do that, we are continuing to refine the speakers for the rest of the month. Some of the people that we've reached out to and working to schedule have extremely busy professional lives, and so we're moving. So we'll hopefully get announcements out very shortly for the rest of the dates for for the end of March as well as into April. So Wida, let me turn it over to you, and you can introduce our guest speaker.
Thanks, Dr. Eckel. Hello, everyone. How's lunch? Fabulous. Well, I haven't had the privilege of meeting each and every one of you, but I am one of the latest professor of practice, and my expertise lies in the community space. So it is just a real joy and a blessing to introduce to you one of the leaders and advancers of community pharmacy practice. He's also a dear colleague and friend. So Dr. Eckel, I appreciate you giving me the opportunity to introduce Joey McLaughlin to each and every one of you that are here in this room, upstairs, and in Karpen Hall in Asheville. So without further ado, listen intently, hear the creativity. As one of the leaders, Joey McLaughlin brings us his story of reload drug.
Thank y'all very much. It's a pleasure to be here to talk to y'all. I'm going to do a light overview on opening a new store or buying a new store. I left a lot of room at the end for questions. If you have questions how I got there. First of all, I graduated from Chapel Hill in '83. I sat hours upon hours in Beard Hall. Side by side, no computers, it was all handwritten notes. I am the president and owner of Reload Drugs and Callahan Home Medical, my wife, Tammy. We started in 1996. We currently have 20 locations that are retail. We've fixing to add another one in about 30 days and another one in about 6 months. We also own 6 Carolina Home Medicals. That's our sister company. It's a durable medical equipment. Started that in 1996 also. Within those 20 locations, I have a full compounding lab, about 2,000 square feet. We just remodeled. We went from about 500, 600 feet to a full operating facility where we do hazardous and non-hazardous compounding for all our locations, and we ship across the state. We also have a closed door pharmacy in New Bern. It handles our group homes, assisted living, retirement homes, and it's a central fill model for all our compliance packaging. We started about 4 or 5 years ago. That's been a really big push we've done for compliance for our patients. It's been received really well from our medical staff in all our areas. We also have a specialty pharmacy in Mooresville. We opened that about 5 or 6 years ago, where we handle specialty drugs for our own clients and other clients in the state. They are currently licensed in 17 states right now. Hope to be licensed by 26 states by the end of the year. I also started, my daughter went to school here. She's a pharmacist and her husband is also from here. Ashley came to me. She worked 1 year on the bench with me, and then she had an idea and we started talking about it. We developed a clinical model. We now have 3 full-time pharmacists and 2 full-time techs. All they do is clinical for our locations. We have contracts with ACOs. We have contracts with hospitals and other providing groups to provide transition of care, monitoring outcomes, and other services related to clinical. Give you kind of an overview. Open a new store. Where do you start? This is an example of a store we opened about a year ago. You can tell it was a bank at one time. It was empty for about 2 years in Beaufort, North Carolina. We wanted to be in Beaufort, so we got to looking and started talking. And the location was good. When you open a new store, 2 of the things you want to think about are, okay, do I build a new store? Or do I try and find a retail space with like something like this or a strip mall? New construction is expensive. Unless you've got a lot of backing with you, it's easier to go into an existing strip mall or something like this. We took that store and, of course, you can tell we landscaped it, put a fresh coat of paint on it, remodeled the inside, put our signs up. That's been a very, very productive store. There was only one other independent in that town. They closed about 6 months ago. The man retired. But let's see if I can go back. But you want to look at your location. It's real important where you want to start. Also, you want to look at your competition. Are there other independents there? Are there other chains there? I don't worry about operating against a chain because it's all about customer service and the service you provide that they cannot do. So I look at that. Some of the service you might want to consider offering if you go into a new business. Are you doing some type of delivery service for your patients? We do deliver at all our locations. Some stores are 3 days a week. Some are 6 days a week. Our stores are open Monday through Friday, either 8:30 to 7 or 9 to 7, 9 to 2 on Saturdays, closed on Sundays. We were open 7 days a week when I first got started in 1996. I did that for about 10 years, and we decided that Sunday was a good day of rest for our family, for our employees, and go to church. So we started closed on Sunday. We never missed a beat. We gave about 6 months notice to our physicians and to our patients, and we never dropped. Our business never went down, it actually went up. Some of the things you want to think about when you go in the store, we're all going to fill prescriptions. And I tell the students, we have about 50 to 60 students rotate through Real Drug every year. I always tell them, you will always fill a prescription in a bottle. But those days are getting smaller and smaller as far as your profit margin. You have to expand your services. So you look at things you can do in your area that other stores aren't doing. That's why we developed clinical. That's why we did specialty. That's why we did compliance packaging. One thing I want you to keep in mind, that's 23 years of work. We didn't come out of the gate day one doing all those services when I first started. When I first started, we tried to make an impression. I worked 18 months, 7 days a week. No relief pharmacists because we couldn't afford it. So it's a commitment you got to make. Clinical services, we got it about 6 years ago. We've had several residents come through our site. We've hired 3 of them who have been very, very successful in our business. But those are things you want to consider if you're thinking about opening your own store. Some challenges you're going to have is hiring, finding employees that you trust that want to work, training them. What kind of salary are you going to pay yourself? What kind of salary are you going to pay your employees? That's your biggest thing you're going to have to hurdle. Benefits, do you offer insurances, medical, dental, long-term disability? Those are things you got to think about. Inventory. Average inventory costs when you open a store, that I've done it enough, you can average between $85,000 to $130,000, depending on your product mix. Most wholesalers were like NC Mutuals here in North Carolina, Smith Drug, of course you had the big 3, McKesson, ABC, and Cardinal. They will help you with an opening order. A lot of time they'll give you credit for an opening order to get you through 4 or 5 months before you had to pay for it to get your business off the ground. You've got to have financial backing to do that. Choosing a wholesaler, NC Mutual, Smith Drug, somebody that's local to your community, also a PSAO. PSAO is a big thing now. It's pharmacy system administrator. They help contract your pharmacy with all the contracts that are out there. That's been the biggest change that I've seen in the last probably 7 years. In 2016 to probably 2020, it was terrible on reimbursement. You'll hear PBMs, that's pharmacy benefit manager. They're the ones who work out the contracts and rebate for the manufacturers. That money does not come back to the pharmacy, it goes back to them. PSAO will contract with the PBM to figure what contracts do you want. Blue Cross Blue Shield, do you want ESI, which is Express Scripts. Those are the things you want to think of. The 3 biggest PBMs in the country are CVS, Caremark, Optum, and Express Scripts. They represent 80% of all contracts for pharmacies as far as developing that price code, that price schedule. So you think about it, three companies control who we're going to bill. The PSAO contracts with them to get you in that network. You got preferred and you got non-preferred. Those are things you're going to have to deal with when you open a new store. Which contracts do you take? Which ones do you not take? Rewards, if you open a store, you're your own boss. You control how to run the pharmacies and services you want to offer. You can create your own security and satisfaction, and you can become a voice and a leader in your community. How do you get started? Looking at your hometown where you grew up. riding around. If you're in the community, you hear something. Out of the 20 locations, 10 of them I found by listening to people talk, going to meetings where it was a CE meeting or some type of function, hearing people complain they had nowhere to get the pharmacy that took care of them, or all they had was change and there was no independent. That's how I got in most locations I'm in. I don't have any secret sauce. I don't have any special formula I use to look at. I usually go to a town, I'll ride around for a day or so looking at what's there. I'll walk into the chains, see what they're doing, how much business they have. We've gotten big enough now, we've got a lot of connections, we can kind of figure out what the volume is as far as prescribing habits are in the area. I'll do that and then I'll go back and figure out how we're going to get there. Am I going to build or am I going to try to find a strip mall? Specialties you can provide. Clinical is the biggest thing I think is the growth of our pharmacy, what you kids are going to be in now. Filling prescriptions is always there, like I said. Clinical is where it's going to go. What service are you providing in your pharmacy that you can outdo your competition, man the change? They're not going to be able to do the clinical like we do it. Hands-on, what are you learning how to do now is different how I learned. We've grown really big in the clinical market. We have an ACO, which is in our town in New Bern. My daughter and one of the residents got connected in there. We see every one of their patients now that goes to the hospital. Whether they shot with me or not, we have access to the electronic health record. That's huge because I got a clinical team that's constantly watching what that patient is being prescribed. We can see what the doctor says when they can see that visit. So we get paid now to follow that patient with that physician. That is huge in our market now. Business partner, excuse me 1 second. You want a business partner. It does help. If you have a partner, you can share the expenses, you can share the workload. Just remember, if you have a business partner starting out, where are you going to pull your salaries from? That's the big thing too. Will you trust that partner down the road when things start changing? I've been in business with one partner for most of my career. He was about 8 years older than I was when we first started Carolina Home Medical and the Relo chain. We developed 6 stores together. And then he did not want to do any more, so I started opening my own. And about 6 years ago, I bought him out, so it's just me and my wife. Carolina Home Medical was the same way. I was in a partnership for 1 store with 2 other partners. I would highly discourage it. 3 voices is too many to have in the pot when you're trying to make decisions. So that lasted about 2 years, and we ended up closing that store because it was not doing what it's supposed to be doing. Buying an existing store. This store right here is in Beulahville. We bought that about a year ago from a friend of mine who was ready to get out of pharmacy. It's instant volume. They've already got people coming in the door. They're already filling prescriptions. The staffing is already in place. You can look at their history. When I look at a store that I'm fixing to buy, we'll ask for 3 years of tax returns and 3 years of dispensing data. We can kind of tell, is their volume going up every month? Or is it going down, or is it flat? The reputation in that town is usually already established. The pharmacy contracts, the pharmacy wholesalers are already intact. In this particular store, the company he was using to buy his prescription drugs from, we changed because we had a better deal than he did. Challenges in opening a new or an existing store. Is the interior or exterior outdated? Most of the stores that we buy, they're outdated. So most of the owners have not done much to their store in probably 15 or 20 years, so you've got an expense there. Are their employees trainable? Are they open to new ideas? For example, when we bought the Beulahville store, when I did a meeting the first month before we took over, I walked in there, they were doing about 400 a day, and they had 22 employees. I about had a heart attack when I walked in there the first night to provide pizza to introduce myself. I'm thinking, what are these 22 people doing? Well, luckily, a few of them didn't want to come over with us. We repurposed a few of them at different locations, and now they're down to 12 employees, and it's working like a charm. And we're filling probably 20% more now than we were a year ago by the services provided. Is your current owner willing to stay? These are neat ways to buy stores. I try to get the owner to stay because he's been there or she's been there for X number of years. She's got ties to the community. It's a great conduit to introduce you to all the new patients coming in. The owner of that store stayed for about 2 or 3 weeks with us day to day, just introducing. It makes the transition a whole lot easier. How do you calculate the value when you buy a store? A new store, there is no value because you're starting from scratch. On a store you're fixing to buy from a potential owner, your inventory is your inventory is your inventory. That's a dollar figure. It's a true asset. You want to look at what their volume they're doing, what the last 3 years have been doing, up or down, and then you get their tax return, and then you look at the net profit, which is the money that's left over after all the expenses are paid, and you come up with a figure. Most of the time, the rule of thumb is you take their net profit average over 3 years, and you do a multiple of 3 or 5. The higher the number means the business is still going up, and he's got a very robust company that you can buy from. Blue sky is the amount that you're going to pay him above asset. That's your inventory, your fixtures, or anything that's a true asset in the store. Blue sky amount is the hardest thing to sell to a bank if you're borrowing money to buy a store, because it's blue sky. There's no true tangible asset. You're banking on what you're going to do once you get in that store. Having a good plan and having a 3-year record, you tell a bank, well, we're doing this for the next, they've been doing this for the next 3 years. We think we can improve on that, so they'll lend that money to you. I'll go back. I hit the wrong button. There you go. Calculating the value is a hard thing to do. I've got a store we're fixing to probably purchase in the summer. It's 2 gentlemen who have been in business for 25 years in this independent. It's a good store. Their volume's kind of flat. They've not done anything different in 20 years in their store, so you can imagine when you walk in what it looks like. Their blue sky in their mind is going to be really, really high because they've given their heart and soul. That's the hardest part that I had to deal when I look at buying a store from somebody, because I want them to feel comfortable. Chains will usually give them usually $100 to as much as $400,000 more than I will, because they're trying to get them out of business. They'll take this, they're buying the files. What I sell is ourselves, what we do, how we treat our patients, their patients, because they'll come in, more than likely shrink the volume of employees, and then transfer the files to another store. They'll have that owner stay probably 6 months to a year, but they won't pay them the full price up front, because they want to make sure they can retain that business in 6 months to a year. So that's one thing you got to watch out for. If you're looking to open a new store or even buy one, I highly suggest, unless you feel real strong urge to do, is to work for an independent or even work for a chain to get experience on what you see. You can learn a lot from the chain. When I graduated in '83, I went back to my hometown and worked for Johnson Drug, a local independent. While I was there, I opened a second store for them. I started a DME company. I started a home infusion. They gave me the tools and let me do whatever I want to do. They're tremendous bosses and mentors to me. The reason I left is we were getting so big and we're doing so many different avenues. They were comfortable with what they were doing, which was nothing wrong with that, because they were 23 years older than me at that time. So I had to make a choice. Either I was going to stay there and buy back what I bought or what I built, or I would leave and start my own business. So I left in '95. I worked for a chain for about 12 months. That experience was invaluable because I saw how the bigger chains operate as far as how they conducted their business, how their models were. And then I started my own business in '96, August of '96 when we started. 23 years it took to grow this. So keep that in mind if you want to open your store. It's not hard, it's dedication. I would not do anything different. I probably would have done it sooner, knowing what I know now. It's very rewarding. We have probably right at 400 employees in our company. That is a challenge every day. When that phone rings before 7 o'clock, I got somebody out sick, or somebody's got a family issue, or something's going on with children. So it's a constant issue you deal with. I've been very, very blessed over the last probably 8 years. I have developed a very good team We have a CPA on staff. Of course, I have a clinical team. I've got a operations manager up front. I've got an operations manager in the back on my OTCs, and I have got a district manager. We have a merchandiser manager that goes down to all our stores and helps set the stores up. Excuse me. But it's very rewarding. I'll tell you, you got to be willing to commit. It's not going to be a 9-to-5 job or 9 to 6. You've got to be willing to put the time in if you want the rewards like this. Any questions so far? Yes, sir.
What percentage of your business is the clinical aspect?
At our New Bern store, it probably represents about 15%. We average probably 2 to 5 new patients a week that come from the ACO or come from the hospital or other physicians. We're taking that model and going to other towns like Greenville, Wilmington, and Jacksonville. New Bern, I have 4 locations. Jacksonville, I have 3. It sounds like a lot in New Bern, because New Bern's the county, Craven County is probably about 45,000 total. And we have 4 drugstores there, which sounds like a lot. But 3 of those 4 are in my top 5 of production as far as prescription volume. The clinical aspect is pretty neat because we're dealing with the physicians at their level. We're building their compliance. For example, CCHC is the ACO we have in New Bern. We have formed a great partnership with them. The first year we had a resident, they let us put a resident in there 1 day a week to do their well care. That has grown significantly now. Now we have complete access to the EHR of their patients. A year ago, all we were doing was taking the patients that were ours, the Realo and CCHC. They saw the volume of the care that we were giving. They've got a humongous bump payout from Medicare for their standards and their scoring. So now we see every one of their patients come to us via EHR first to review their med chart, especially we talk to them within 24 hours of discharge, and then 7 days we help them set appointments up. So now we're seeing every one of those patients. I can tell you, when our staff calls that patient that we're not a Realo, guess what happens now? They're a Realo patient. Compliance packaging we started probably 8 or 10 years ago. Every store was doing it. It was strictly bubble packs, trying to get them compliant. We went to a 7-day pack. We were doing it manually, and every store was doing that. And we got to thinking, this is crazy because I've got a pharmacist tied up at New Bern. We had a pharmacist and 2 technicians. That's all they did every day. Well, I had other stores doing the same thing. So we created a closed door pharmacy. And now all those patients that are on compliance patching get routed to New Bern. We have a robot that fills those packs now for us. It's computer generated, it's color coded on the inside. Patients can see the description of the tablet or the capsule, a description of it. 7-day blister is perforated. Very, very good looking. It's very easy to market that. So we started doing that. That store now is probably, or that company now is probably doing about 30,000 prescriptions a month. We do a central fill. The patient will walk into any of our 20 locations. The pharmacist or the clinical pharmacist or the pharmacist will see this is a candidate for a compliance packaging. They'll talk to them. They'll get them set up in the store manually. Once that patient is synced, they get sent to New Bern. Those packs are back in that office about 5 to 6 days before they're due for pickup. If the patient has a med change or a med addition or deletion, it's done at the store level because we want that patient to have that relationship with their local pharmacist. Most of our patients don't even know they're getting filled in New Bern. We fill them, they're shipped to the next store the very next day. That's been a very, very big win for us as far as getting into doctors' offices and hospitals because of compliance. We keep them compliant. Our staff, we have 6 members of a call team in our central fill. They're calling those patients every day, a week out, saying, have you had any changes? Do you have any left? Any additions or deletions? So we're talking to that patient one more time before they get their meds up. Very, very important. Any other questions? Yes, ma'am.
How did you like know how to run your business, like the business side of things, like when you first started? Like,
Working for an independent when I first got started, I grew up in the drugstore. I started there when I was 16, so I knew the upfront part. I went from cleaning shelves, deliveries, to cashier, then technician. That's how I got interested in pharmacy. Watching my owners work, asking questions was the biggest thing. And then when I started my own, you learn by trial and error. I have made mistakes. I have closed 3 stores in the last 6 years. 2 of them probably should not have closed. I had the wrong people in the wrong place. I did not realize that until I got in there and started seeing it. It was too late then. But so I learned by those mistakes. Just paying attention day to day. Taking care of patients is the easiest part. The business part is what you got to learn. Just like a checkbook, you got to know what's coming in, what's going out, what you're going to spend your money on, what you're not going to spend your money on. So a lot of just hands-on. Any other questions?
Piggybacking off of her question and what you just mentioned with like knowing what to spend your money on and kind of learning about running a business, as you've grown and scaled up, how have you decided at what point to hire things out? In terms of like, does that make sense? Where it's like, okay, this is not my strong suit. I better hire, a person to take on like managing people, whereas I'm a lot better with numbers. So
When you start out that way, you're doing everything yourself. You're writing your own checks. You're doing your own payroll. You can contract with an accounting firm to do that for you. We did that once we got started. About 10 years into our business, the CPA that I was working with at a national firm, we hired him. We bought him in-house. That was a big move for us. It's an expensive move, but then we had more control and it was cheaper in the long run. Developing my team was the biggest thing, like our specialty pharmacy. I had two kids I hired right out of a pharmacy school. I met them through a residency program. Charlie and Will, they run the specialty. They were in Lillington for about a year and a half running that store for us, a retail store. They approached me about a year into their employment. Hey, we'd like to get into specialty. I thought about it. I did not have the expertise or the time. They had worked in their residency program at some specialties. So they came to me. We had the real name. I had the backing. So it was a good stair step. So we researched it. They bought me a business plan, want me to invest my corporate money into that, which we did. And now they're in 17 states, fixing to be in 25 states. So yeah, I looked at hiring the right people. You can get the right people on the bus, but you got to get them in the right seat. And I had to move managers around the same way. They could be a great pharmacist, but they're not a good manager. So I got to find a place for them. But the specialty was that way. The compounding the exact same way. We had stores doing compounding. We all do typical compounding, but we were getting a lot of calls. Several stores were getting calls. And we found ourselves spending 2 or 3 times the amount of money on inventory, procedures to get stuff done. So we brought that into a central field model in New Bern. And we've got a state-of-the-art, ready for USB 800 to be passed any day because of that. Any other questions? Yes, ma'am.
I had the pleasure of rotating through your stores in Jacksonville last year, and I had a question regarding how you decide what insurance contracts to take and when to walk away.
Okay. That's a very hard question because you hate to tell somebody you can't take their insurance. We look at what the reimbursement is based on acquisition AWP. We look at is it a 30-day or 90-day mandatory? I can tell you, for example, like ESI or Express Scripts now owns TRICARE. You're seeing a big change in the market. These companies are starting to gobble up these other insurance carriers. You've got to figure, we've got a lot of Marine Corps, Air Force, Army in North Carolina. So there's a ton of TRICARE. We don't like TRICARE because the reimbursement is terrible. The last 5 years, if you look at the group of business of TRICARE only, we lose money at the end of the year. You might make it on one, but when you look at group of business, we currently are trying to get out of the TRICARE contract. I don't want to do that, but at the same time, you cannot fill a prescription and lose money on it. With the technology we have now, with the software we have in pharmacy, when we transmit a prescription, we know exactly what we're getting. So Kyle, my son-in-law, who's a pharmacist, he ran a store for 5 years, but his knack is contracts. He can work them contracts to a T. He's calculated in our software. When we fill a prescription, we know what we're getting, and we make that decision. I hate to tell you this, I never thought in my pharmacy career I would have to look at a price before I dispense a prescription, but you have to now. It's that bad. Not to discourage you, we're still viable. We're still growing. People ask how many more stores are you going to open? I have no idea. That's a God thing. He put people in my path. That's where I'm going, and as long as He's leading me, that's where I'm going to go. My wife wished it was 10, but she's already passed that 10 mark. So, and if she was here today, she'd tell you the same thing. So, any other questions? Yes, sir.
Considering like where you started and how much you've grown since 1996, and that you're still continuing to open up two within the next 6 months, you said, why do you want to continue to grow? And what pushes you to do so?
Because I love what I do. I love pharmacy. I'm on the counter still almost every day. I lost a PIC 6 weeks ago, and I've been in his store every day, Monday through Friday, 8 to 6 or 8 to 7, and getting the work done. It's a passion I have. I grew up with it in pharmacy. It's just a lot of fun. I love putting people to work. I love trying new things. I am not scared to spend $1 on trying something new. And I have done that, and I have lost. We closed 3 stores that were expensive. One of them was one we built from the ground up. So we had about a $1.2 million investment that I had to sell that store because it was not producing after 5 years. We saw the negative, it was not changing. So doing that, putting people to work, and then by me expanding, we've been able to expand to different types of service pharmacists. It's really broadened what we do in pharmacy now. We're just not filling prescriptions and putting them in a bottle. We're clinical. I have several of my pharmacists who are long-acting, certified immunizations. We did last year, our company did close to, I believe, 16,000 immunizations. 16,000. We have probably 8 county schools in Eastern North Carolina where we'll do all the teachers. What better marketing is that when you got a pharmacist sitting there talking to that teacher or that principal or that staff, what you're doing for them? We do large corporations, Moen, Weyerhaeuser, we do those every year. It's just getting your foot in the door. Sometimes it takes 2 or 3 years to keep making that connection, but you're delivering that service to them. Yes, ma'am.
With like new things that come up, like things such as like the House Bill 96, like how do you incorporate that into your like company?
Say it one more time.
The birth control, like the prescribing, like new things like that. How do you incorporate that into like your business model?
Well, first thing we do when it comes available, we see who's interested. Because not every pharmacist wants to do it. We find out the ones who want to do it, and then we create and it comes from our clinical team. They'll create a policy and procedure how to implement that, and then we lay it out there. The birth control has been very good. We're doing that centrally. We've had a few agencies see what we're doing, how we're doing it, and now they're buying into what we're doing. So you got to have an interest. If you're a single pharmacist, you can't do it all. I'm just very fortunate now we have a diverse team. Some want to do it and some don't. I think we got 62 pharmacists in our family. I think I have 3 that will not immunize. I will never force them to do that if they don't feel comfortable doing it. Just like the birth control, the long-acting injectables. The pharmacist got to have that willingness to want to do it, to do that. Okay. Yes, sir.
I can imagine it's pretty hard competing with some of those bigger chains, especially when you're looking to open new stores and buying existing stores. I was curious just like kind of what techniques you use to convince the, I guess, employees or owners of the existing store to like go with you instead of like a bigger chain that might be able to offer them more money?
That's a good question because I'm dealing with that right now. The biggest thing is we compete against the chains every day. Is service. You walk into most chains, and I'm not trying to bash chains, they're very low staffed. Whereas we're full staff. We're going to have cashiers, we're going to have enough technicians, and we're going to have enough pharmacists rotate. So you form that relationship. The owners, I'd say a large majority of them don't want to go to a chain because they know what's going to happen. Because they're going to work 6 months to a year under contract, and then they're going to quit, but they're going to either divest all their employees into their chain or not use them at all. And those patients are going to be, I can give you story after story where that's happened. But I also understand those owners who have worked to 75 or 80 years old, they're looking for their money also. So it's kind of a hit and miss. I'll give you an example. We opened a store in Wallace that had 2 owners 7 years ago who wanted to sell to me. They did not want to sell to the chain. But when I ran their numbers, the price was here. And I told them I cannot do anything more than that. Walgreens price is way up here. So they sold to Walgreens, and in 3 months I come in and open the store, and guess what happened? All those patients that went to Walgreens come to us that quick because of service. So it happens that way. Because when you go to the bank, a number is a number. You've got to be within that guidelines to make it affordable to make your payments and to afford your bills. Okay? Yes, sir.
How do you connect with people to find opportunities to buy out their businesses?
Well, we're fortunate now because of our size. They know who we are. Our wholesaler, ours just happened. I was NC Mutual for probably 15 years. We're now Smith Drug out of Spartanburg. They know a lot of time when stores are fixing to close or want to sell, they'll reach out to us. The sad part is a lot of time the owners don't want to tell anybody because they don't want their wholesaler to know because they're fixing to sell and they don't want to ruin that relationship there. So that's kind of a juggling act. We've had several requests in the last 4 months to go outside of North Carolina because we got stores in South Carolina, Virginia. We're currently looking at that model. That's a pretty good stretch for us. I'm in most of the stores. Other than the last 6 weeks, I try to be in the stores at least once 1 or 2 months. I'll go in and spend a day. I tell you what I do when I go in there. I go in there and I tech. So I'll learn more teching, how they're answering the phone, what their flow looks like. I don't go in and just talk to them. Hey, you're doing this, you're doing this. I'll come in there, pick up a tray, and just start counting and listening and answering the phones. It's very, very good experience. But then you know what they're doing. Yeah, they're going to work a little more different when you're there. There's no doubt in my mind about that, but at least you see the flow. You pick up a lot that way. But word of mouth is the biggest thing. Because of our size, and we've been doing it for 20-something years, people know who we are, and they'll reach out to us first.
When you weren't as big as you are now, back in the early 2000s or so, how did you find those people?
I didn't have that many then because I can tell you, most of the stores we opened probably we were doing 3 a year for about 4 years. It was a lot of work, and it never failed. They would open up around November, December, which destroyed my wife. But it just the way construction was. Most of it was I just listened to people talk. I'd go to CE events. That was a mixed collection of retail and chain, and I'd just be listening. How many they're doing? Where are they located? Fuquay Arenas is a prime example. We have a store there. I was at a CE and I heard these 2 Walgreens pharmacists complaining they're doing 1,000 prescriptions a day. There was not an independent there. And by God's intervention, I had a pharmacist that was from Fuquay who was thinking about moving to New Bern. Well, now he lives in Fuquay and running that store in Fuquay and is doing very, very well. So it's just listening, attending trade shows, CE events, just keeping your ears open. That's how we got started. And then I love to ride around our state. I'll go through a town and look around. I'm looking for pharmacy. My wife's looking for gift shops. So I'm looking, and if I see something, if I don't see one, okay, why don't we have an independent pharmacy here? Independent pharmacy is very, very rewarding because you get to control what you want to do. I think it's harder work to get started and to maintain it, but it's very, very satisfying. There's nothing wrong with chains. I did it for a year. It's a great experience. But if you want to control that future of what you want to do in your career, independence is the way to go. And right now, even though the reimbursements are terrible, it's still a great business to get into now. 2016 to 2020 were very, very hard with the PBMs and the clawbacks. Just kind of give you a perspective. The number is huge, but we do a tremendous revenue. We were losing $4.1 to $4.6 million a year. They were taking back from us. Well, that destroyed our bottom line. We had to find out how to do stuff. And we've come through it now, and we're much stronger now. We had to make some hard choices as far as salaries go, what lines we're going to carry and what lines we were not. I still opened one store during that time. It was hard, but we went through it because of dedication and perseverance. That's what we did.
So I guess to follow up on that question, what are the main differences in opening up a store now versus early 2000s, kind of late 90s when you started?
Night and day. Profit margins were completely different in 96 to probably 2012 to 2014. You were operating 35 to 45%. Now you're operating on maybe 13 to 20 if you're lucky. But you streamline your operation. Because of our size, we're able to negotiate better buying contracts from our wholesaler. Inventory control is a tremendous asset. It's real dollars on your shelf. But if you don't need $500,000, you can operate on $300,000, that's $200,000 you have in your bank. Here's a good example. The store we're fixing to close on April 2nd. We were able to go in there last week and kind of eyeball the inventory. He had $39,000 in his refrigerator that he had not used in 18 months. How smart was that? The first thing we did, we helped him do a big return. His inventory he was doing about 250 a day, was 463,000. Should be about 250, 275. I've learned that through years of experience. Our average inventory turn at all our stores average anywhere between 15 to 25 turns a year because of inventory management. There again, by our size, we got real lucky. This comes from one of my managers. We do a central transfer log every 120 days. He'll go into every computer. What drug have you not used in 120 days? Goes on a list. He finds a store that uses it, and we do inter-store transfer. That is usually about $225,000 to as much as $400,000 every 4 months that we're moving. So those are little things you learn. Did we do that at the very beginning? No, because my guys don't like me to order. So if we don't have it, I'm ordering 5 or 6. That's just old school. But inventory control is the big, big win you got to have in your company. So that's dollars you've paid for sitting on the shelf that you've not used. So having our size has helped us tremendously. Can you imagine moving $200,000 to $300,000 every 4 months? That's huge because it's sitting on the shelf somewhere not being used. Yes, ma'am.
What types of new technologies have your stores implemented that have seen to be effective for the pharmacist and the patients?
I couldn't hear you.
Right, like new technologies that your pharmacists appreciate, but are also very effective for your patients that are unique to your store.
They're unique to us. I would say the compliance packaging is the biggest thing for the way we do it. This fills one. People use the 30-day blister cards, and they all work. I did that at the beginning, but because of our size and because we want to make that a marketing avenue for us, we spent $750,000 for a robot, and it's tremendous. It works all day long. The clinical services was huge. Having a pharmacist not tied to a counter who is making them calls to the patients, calling the doctors, doing the marketing was huge. And that's been our biggest growth. That's where I see the future growth of pharmacy. We'll always fill prescription. I know I've said it 3 times, but it's the ancillary services that we do will set you apart from any other store in your community or the state. Yes, sir.
So when you're buying a pharmacy, in addition to other chains and other independents, have you seen more competition with private equity firms in recent years as they gain more interest in healthcare?
I have not. We have not seen that. I'm not worried about competing against the chains. I usually don't go into town unless I have to. If there's an independent there, because I don't want to fight another independent. Now, if it's an older independent who is not doing anything, literally nothing, we'll go in that town. Private equity, we have not seen that. I have not seen it on our side. I think it's too volatile for private equity to get in. Specialty is a different animal. We have had one group come to us that was a private equity for our specialty because of the size, mainly because of the access. When you're in 17, 18 states, you've got a presence. So therefore you can get limited distribution drugs or limited contracts. So that becomes real valuable. We built that to grow as a possible sale down the road. I see that in my mind, and Will and Charlie know it too. That's my bank down the road. So they know if we do sell, I'm opening stores, retail. So, and that was a big plus for us when we built that one. We took all the drugs we could not fill from at that time, there was 15 locations and funneled them into specialty. So now we can fill them. We're keeping that patient in our family. They're not having to go to an outside source for specialty. Okay. Any other questions?
Well, I got one more to end on. You intrigued me when you're talking about TRICARE and losing money on that. Have you ever evaluated a cash-only pharmacy or a generic-only pharmacy to try to get around some of the losing money on brand name drugs?
You must have talked to my son-in-law because he preaches that to me every day. He wants to do a cash pharmacy. We have talked about it low level. I don't think I will do that. The one thing, I thought about this the other day when the conversation come up, if you did a cash pharmacy in somewhere in our area where I have a retail, then we're sending those patients to a cash pharmacy and they're still getting insurance prescriptions. So am I hurting these other stores if I start farming all that cash out to one store? I think I've got a friend in North Carolina, that's all he does. He's licensed in 50 states. All he does is generic cash. There's a place for it, but you got to get established in it. I don't see us doing it. I don't think so anyway.
I mean, I was trying to figure out how it would work in your model in terms of being spread out, and I didn't come up with it, but you're obviously very creative in what you do, so I didn't know if there was a interesting thought to it.
He would love to do one today.
Well, I can tell from the questions being asked here, there's a lot of interest and as you can tell from his passion and his voice, he still thinks independent pharmacy is strong and has a place in North Carolina. And clearly by continued growth, you can see that. So let's thank Joey McLaughlin for coming and joining us today.
If anybody wants, I'm gonna be here for a while. If you got some questions, you want to just talk to me one-on-one, I'd be more than happy to talk to you also.